Hello, I'm Sharrie Darlin-Davis, and welcome to this episode of Reid Beside You. Today, our guest is Carrie Miles, and Carrie is the CEO of the Neighborhood Health Center. And welcome, Carrie.
Welcome. Thank you, Sharrie.
Tell us a little bit about the Neighborhood Health Center. Well, before that, tell us your background, please.
My background in healthcare, I was born and raised here in Wayne County and graduated from Ball State with my undergraduate degree in medical technology and worked in the laboratory at Reid Health for several years. Transitioned into lean management over the course of about 3 or 4 years and worked there and had a great experience and learned a lot about healthcare as an organization. Transitioned into business development and worked in that field for a couple of years and really was able at that point to really learn about Wayne County and the health needs. When the position became open that the Neighborhood Health Center was looking for a CEO, and went through the interview process with the board of directors and was fortunate enough to be chosen and have been serving in this role for will be 2 years in July of this year.
And tell us, what is the Neighborhood Health Center?
Neighborhood Health Center is a federally qualified look-alike clinic. Right now our location is on South A and 10th Street. And as a federally qualified look-alike, we provide primary care as well as behavioral health services, access to dental care, eligibility services for patients regardless of their ability to pay.
And when explain what a FQHC, Federally Qualified Health Center,
Yes.
look-alike, the difference between an FQHC and a look-alike.
Sure. A little bit of a distinction in terms of how our funding is. But as a federally qualified health center look-alike, we are required to meet all of the regulatory issues that all FQHCs have to meet. And those would include governance. There's very strict guidelines about how the governing board is structured, our services that we have to offer, and different varying sliding fee scales for patients to be able to qualify for reduced services. So our services are based off of patients' income and family size and where they fall on that federal poverty guideline limits. Mm-hmm. And we are required to provide the primary care, behavioral health, access to dental services. And I think the difference there is from a typical clinic that you'll see is all of the wraparound services. So care coordination is on site. We provide assistance with transportation issues, prescription assistance, eligibility services, some of those issues that our low-income population are going to struggle with, and provide access to that care and help eliminate some of the barriers in their life. The difference between a look-alike and a full grantee is we do not have access to grant funds.
Okay.
So our funding is a little bit different and how we're structured there, but all of the regulatory issues are things that we have to hit and be measured on an ongoing basis.
And we'll go into some of their services a little later, mm-hmm. but one of the really big distinctions that we always see are your governing board.
Yes.
And the makeup.
Yes.
Can you describe how some people that you have, not necessarily their names,
Sure.
but just a wide variety of people that you have on your board?
Right. So HRSA, which is the branch of the federal government that oversees FQHCs, has very strict guidelines about how your governing board has to be structured. They want the governing board to be a representation of your patient population. So they want representation to include all walks of life and all ages, races, genders, those types of things. So our governing board is certainly that. They are a very eclectic group of people. We have those that have worked in the private sector in community relations, patient services, those types of things. We have a lot of nonprofit board members. We have those that are in the education world, in the healthcare world, in legal, and those types of groups. But the biggest distinction really is that at least 51% of our governing board must be patients or consumers of our center. So we have currently 13 board members, and 7 of those are patients operations of our center. So they really have been able to bring a very neat perspective, both from a professional side and a personal side of how they have seen their services go at our center, and certainly have brought a really neat guiding principles for us to be able to make sure that we're providing great quality care, in a respectful manner. So that really has been a neat process to see them go through, and not only just learn how to be board members, but how to be board members of FQHCs. And HRSA is really good about providing guidance and support and training for those individuals to be able to make informed decisions and really be on the forefront of where we want to go as an organization. Most of our board members have been on board since even before we opened the clinic, so they literally have been involved in all of the milestones and have seen that firsthand, which has been really beneficial for them.
It's
We've gone through the
it's
process.
been interesting to in the community work with some of your board members.
Yes.
And they're very proud to be board members,
They
as
are.
well as making sure that people that are in need are aware of the services that are available at the neighborhood health center.
Yeah, and they really all came with us from such varied backgrounds and just knowledge, knowledge of the community, knowledge of healthcare, knowledge of the patients that we're working to serve, and I think they're learning a lot and been very, very engaged in the process and pushing us and challenging us to do things better and to think about things always from the patient's perspective and how we can meet them where they are and get them to the place that they want to be from a health perspective.
And also, and I know you had a background with Reid, and tell us the distinction that you are not part of Reid.
We are not. So Reid has certainly been a tremendous partner in this journey. I don't think that we would have been able to obtain had gotten so far in the process without their support. But we are a separate 501c3 organization under our own tax umbrella. The governing board is the entity that provides all of the decision making for us as an organization. The relationship with Reid continues as we are leasing space down on 10th Street, and we're currently leasing staff as well. I think anytime you're going to get something as large of this organization off the ground, you certainly need good partners, and Reid has been that for us. Has really provided a lot of guidance, all the way from marketing and billing and the accounting pieces, medical staff services, all of those things. I've been able to tap into some of those resources and some of those relationships that I was able to form, over almost 20 years with the organization.
And a question people have asked myself, that do we have the need to have 3 FQHCs pretty much within miles of each other?
Yeah, I think that's a twofold question, certainly. And really when we first put in our application to become an FQH lookalike, the first thing that HRSA does is they look at the community needs. And they want to understand the communities, where we are from an income perspective, where we are from a health needs perspective. So some of the data is pretty staggering. Wayne County is number 87 out of 92 counties for being the unhealthiest in the state. Indiana is
the list that we didn't want to be on.
The list that you don't want to be on, for sure. Indiana is number 41. So we're literally one of the unhealthiest counties in the unhealthiest states in the country. 24% of adults have had no consistent source of primary care. 44% of our service population lives at or below federal poverty guidelines. 70% of our patients live within a 10-mile radius of our address. So I think when you spoke about the 3 entities being very closely located, I think that's because everyone realizes that that's where the highest need is in the city of Richmond. We're right on public transportation, so we have access to the bus systems. We have a tremendous amount of our patients that walk to their appointments.
And I'd like to stress on that.
Yes.
Off the first couple of times that I stopped through the neighborhood health center disseminating information,
Yes.
I would notice, and then I've had people share with me how there's no cars in the parking lot.
Right. But yet the waiting room is
But
full.
so then I'd walk into the waiting room and it's baby buggies and it's
Yes.
full, and
Yes.
so then that also shows that you located there for a reason.
Absolutely. You know, I think we thought it was a perfect location, and I think the last year has certainly taught us that it is. You know, like I said, we have very good access off of public transportation, although the construction has been a bit of a challenge in that realm. But yes, we do have a lot of individuals that walk or share rides. I think the location is really perfect for us to be able to serve Richmond specifically. And I think that's why all three are located so closely.
So that might be a positive actually right now because of construction.
Yes.
That there definitely showed a need because people still manage to get to your location.
They do, and I've been asked frequently how much the construction has affected us from a business perspective. And fortunately for us, you know, our patients need to come to us. They want to come to us. So we haven't felt the hit as much as some of the other stores and whatnot, but the end is near. They're working away. As I left the clinic earlier this morning, so you know, I think once they get the construction finished up, it's really going to be nice.
One of the numbers that you recited about 44% of poverty. Mm-hmm. There's another area that I don't think a lot of people recognize, and that it's the working poor. They don't necessarily fall into the poverty level, but they're just making it.
Absolutely.
So then I believe the health centers are a very good plus, and they can come. Do you offer a sliding scale?
We do.
Or how can they work with you?
So we really don't their payer does not really play a role into how we are going to work with them as patients. So we have commercial patients, we have Medicaid patients, we have Medicare patients, and we have self-pay. And we've tried to really come up with a lot of different options for them to make their health care affordable and something that they'll engage with. Mm-hmm. So we offer payment plans for patients. We've got staff on site that will sit down with them and help them with the paperwork. I know that's sometimes a barrier for patients to be able to fill out the information in the paperwork. We really need simple things: bank statements, pay stubs, tax records, those types of things, to help get them engaged in that process. And then we're able to provide those additional services. So, you know, we do have commercial patients who are on our sliding fee, and it's just like you said, they're working and they're doing the best that they can to get everything taken care of, but still have that financial burden. And
another thing with the services that are offered, when you were saying with the wraparound service, which, especially if you finally manage to, and you have varied hours, but if a person finally got to the doctor, they got in, and there might be something else wrong, by having access to dental services and behavioral and mental health services, I'm sure that is a large plus, more of a one-stop shop.
It is, I think, and I think the other thing is just, you know, we as a society still have, you know, huge barriers with the stigma with mental health, and you know, we've been very intentional about how we're handling those appointments, and really those are no different than getting your blood sugar checked if you have diabetes. This is just a check-in for you mentally to make sure that everything is going well. And the added plus is that our providers have that ability to share that information between the two of them so that they're making informed decisions, not just about their high blood pressure, but potentially about depression or anxiety. So you know, I think we are just on the cusp of getting our hands around how we can start to break down some of those stigmas, certainly as a society, but starting out here in Wayne County.
The other thing is our area is considered medically underserved. Can you speak to?
Yes, I think, you know, there's still, you know, as we stated, there's still a lot of patients who, you know, are not accessing care. So this is just another avenue for them to get engaged in that. We have patients who have not seen a dentist in years, probably some of their adult life. So I think there's always that opportunity for us to bring the services to the community and be able to improve the health of those individuals who need it the most.
One of the challenges early on when I first started at Reid, I answered the phone for the dentist, the
Yes.
dental appointments, and the average person, you say, hadn't been to a dentist in 20 years.
Right.
And if you haven't been to the dentist, that can start to affect other parts of your body.
Absolutely.
But they were so grateful
Yes.
to even finally get that particular access.
Right,
And they would
right.
literally hug people as soon as they
Yes.
got to the door. So.
Absolutely, and I think that will be something that will continue to work. We're partnering with Mid-America Dental Services here in Richmond, and I think that we'll continue to work with them closely to better serve that population and get them engaged in getting their dentistry needs taken care of.
And being out in the community, I'm a big proponent of access to care.
Absolutely.
Because what we don't want is a $100 problem turns into a $100,000 problem.
Absolutely.
If people continue to not seek care, so
Sure.
it just grows and grows. Your problem does.
Absolutely.
As you're out there, I was looking at some statistics for health centers. It says that 1 in 12 Americans get their health care through a health center.
Absolutely, and that's another thing when HRSA is looking at community needs, they're also looking at the number of individuals who are being served by a health center. So from a government perspective, the one thing that we've been able to see Republicans and Democrats agree on is the benefits of community health centers, and that's really why, because they are able to work in a preventative manner to get those patients engaged in their care and prevent some of the large catastrophic,
Right.
Illnesses and surgeries that need to come, later in life. So very heavily focused on screenings and health maintenance. Those are all quality measures that they're measured on annually and have to report that information to the federal government. So certainly it is something that is top of our mind to make sure that they're getting their mammograms done, that they're having their blood sugars checked, colonoscopies when it's time to be due. All of those things that are not such a fun thing to go through, but certainly something that needs to be done in order to prevent those huge, life-changing medical events that can happen.
One of the things I wanted to share with the audience that as you were preparing to open the neighborhood health center, how you, your staff, and your governing board attended a poverty simulation.
We did, yes.
And for people that aren't aware, the NATCO Empowerment Center puts together a day in the life of someone in poverty.
Yep.
And you go to the various stations, and they have different scenarios. And how do you make it in poverty? For instance, can you move in a day,
Right.
less than a day, like in so many hours.
Yes.
And what would you do if you were evicted? Do you know the services to gather?
Absolutely.
So I had the opportunity to witness
Yes.
your staff, and what were some of the responses?
It was a really neat day. We're fortunate enough. Dana Sinclair serves as our vice president on the governing board, and she is the NATCO Empowerment Center director, and just does a great job, and certainly has a heart for educating the public about the confines and some of the constrictions that individuals who are living in poverty struggle with every day. And it was interesting, as we were finishing up, we had some board members that made the comment that I feel like I'm a relatively intelligent individual, and I couldn't make this work. I couldn't figure out how to work a 40-hour week and still be able to get and make my payments on my house and pay my utility bills because they were closed, or I couldn't provide. I didn't have transportation to get there, and so I think it was a really neat, very powerful exercise that we were able to do, and
It's always eye-opening for people that
It is.
participate in that the simulation, and everyone that I've seen that has gone through the simulation becomes a different person because it gives you you listen totally different,
A different perspective.
Definitely a different perspective. That something that if you've only looked at a more of a middle class or upper middle class life, you have. I laughed. I've been doing this for about 7 years. I remember the first time it was all more CEOs. And no one knew what the pawn shop was. No one knew where certain things, and they had to learn. Or I had one gentleman say, "No one has this much bad luck."
Right.
So,
Right.
I'm glad that your staff got to experience that. So then, when you have different patients, they can empathize.
Well, and I think that was the biggest lesson was, we have a tendency maybe in healthcare to get frustrated with patients who you don't feel like they're engaging in the process. And when you take a step back and you are able to experience something like a poverty simulation, it makes you start to ask those questions of why. Why are they no showing for appointments? Why are they not taking their insulin? Why are we struggling for them to access dental care or whatnot? And I think it's a good pause button for us just to continually try to dig a little bit deeper and understand that patient and develop that relationship so that you understand maybe some of the answers to those questions of why.
Right. And when we're talking about some of your staff members, some of the things that you actually have a person that helps with billing, and you have a claim aid rep who can assist with insurance enrollment on site.
We do.
That is invaluable.
It is, and those ladies truly have a passion. Really, everybody on our staff really has a passion to serve their patients, and they know their patients by name, and they know a lot of their stories. And I think our patients feel that. I hope our patients feel that. And I think that's really what has made Neighborhood Health Center very special. I think really it's just the staff that have embraced taking care of those patients and maybe not being able to go all the way to the end in terms of goals and that, but just being able to help and getting them one step closer, maybe with every appointment to where they want to be long term.
And so, on your staff, are there physicians or nurse practitioners? Could you tell us?
We are staffed mostly with nurse practitioners. We are fortunate we have 2 nurse practitioners with us today, Terry Short and Kim Cox. Terry Short has had a long-standing clinic here in Richmond. We transitioned. Most of her panel came with her when we made the move to 10th Street. Kim Cox started with us last fall. She's from Connorsville and is working to build her practice. And then Aisha Engel will be our 3rd nurse practitioner, and she will join the clinic earlier in the summer. So we're really excited. Again, those 3 ladies really have a heart and a passion for taking care of their patients and bettering their health. On the behavioral health side, we have a nurse practitioner that is in office, and she does a lot of the medication management and helps with diagnosing patients. And then we also have a licensed clinical social worker on site, and he's able to do a lot of the therapies and meet with patients and help them develop coping mechanisms and skills to better their life from a mental health perspective.
And then you have your other support staff, correct?
We do, yes. So care coordination we have on site as well. Robin Hill is our care coordinator, and she has worked with this,
all through the community.
Absolutely.
We have so many people that know Robin.
Yes. So Robin volunteers at the Siloam Clinic, and is just I don't think you can describe her any other way that she's a patient advocate.
Definitely.
And she knows if there are resources to be had, Robin knows them, and she has really been very influential in getting patients that, again, have not had access to care for a long time to get them into our clinic and get them established.
On some of the upcoming, some things that are on your wish list,
Yes.
And what about, do you have for interpreters or maybe for a language line?
We currently utilize language line. I will tell you it is it's not ideal. So certainly on our wish list is to have someone on staff who is trained and able to do translation for us. The language line is a good tool. It's not as personal as what we would like to be able to have. So I'm actually talking with IU East currently to see if we can find some summer interns and our help to get someone on site to be able to do translation. So that's certainly pretty high on the bucket list for the coming months.
And is there anything that you would like our audience to know about that we maybe didn't cover about the Neighborhood Health Center?
I think for me, what I would like for the community to know is that we have tried to approach healthcare a little bit differently at Neighborhood Health Center, and we've been very intentional about creating an environment that is welcoming and respectful for patients. We are obviously taking new patients and would welcome, any new patients that would like to come and come in for services. We really want to be their partner in healthcare, and really everyone from the board of directors to our providers to staff have really engaged in that process, and I think our patients will certainly feel that when they come through the doors down on 10th Street.
And if someone wants to make an appointment, your address, and I'm sure we'll have that on the screen as well,
Sure.
the information on how to become a patient at the Neighborhood Health Center.
We've tried to make that process as seamless and easy as possible. 965-4299 in order to request a new appointment.
Well, great. And we want to thank our guest, Carrie Miles, the CEO for the Neighborhood Health Center, for joining us today on Reid Beside You. And thank you for joining us.